This is Dr. Caudle Miller, Dr. Miller's Guide to Neurology, and today we're going to talk about dizziness. Oh my gosh, when you talk to an ENT or neurologist and they see a new patient out front and they look at their chart and it says they're there for dizziness, they just cringe. I remember standing on a first tee of a golf course and I asked I was playing with 3 ENT guys in a meeting. I said, what do y'all do about dizziness? And they said, oh my gosh, I wish I'd never see another dizzy patient. It is probably the toughest minor symptom in neurology to treat, the toughest problem, because most of the time you do a workup and you don't find anything. I think it's the toughest clinical problem because we just don't have good medication for just dizziness in and of itself. A good history is essential. Do they have vertigo? Vertigo is a spinning or to and fro. You see that more with the inner ear. Or they just dizzy or lightheaded. Is it positional or not? Like benign positional vertigo, it's positional. They stand up, severely vertiginous. They lay on the right side, they're fine. They lay on the left ear, severe vertigo. Is it continual or is it paroxysmal or acute? Do they have nausea and vomiting? Very rarely see nausea and vomiting with central vertigo. Do they have other neurological symptoms like numbness, speech difficulty, weakness? Is this from a brainstem stroke or for a cerebellar stroke? What's their previous workup? What doctors have they seen? If they had seen an ENT, if they had an ENG, if they had audiogram, what medicines have they taken, what they've responded to, like Anavert or Meclizine, Valium or steroids. So what's the workup? MRI with cerebellar pontine angle cuts to look at the brainstem and posterior fossa. Orthostatic blood pressure and pulse, orthostatic hypertension causes dizziness. Lab work, CBC, anemia, thick blood, polycythemia, which is thicker blood. A chemistry profile, look at their blood sugar, liver and kidney function, their electrolytes. Thyroid screen, hypothyroidism, hyperthyroidism cause dizziness. B12 deficiency, vitamin D deficiency. Syphilis can cause dizziness, particularly neurosyphilis. Check the iron and ferritin because anemia can cause dizziness, and check their hemoglobin A1C because diabetes can cause dizziness. Then work them up from a neurological standpoint, send them to ENT for an ENG, an audiogram, ENT consult. Look at their medicine list. So many medicines cause dizziness. I'm about to do this segment on epilepsy. Every single anti-epileptic drug can cause dizziness. And then the dysautonomia workup. Do they have problems with their autonomic nervous system? The autonomic nervous system is the system that works inside you don't think about. Your sweating, your heart rate, your blood pressure. So a tilt table, an echocardiogram, a cardiology consult, and then evaluate for depression and anxiety. Treatment options are based on the diagnosis, but are generally empiric. Everybody tries Anavert or Meclizine, and this is sort of short term. It can make things worse long term. So dizziness is really, really tough. Sometimes we use prednisone, just a trial of prednisone, 30 to 60 milligrams, and taper off 10 milligrams every other day, just a therapeutic trial. And some people are diuretic, like Diazide. I'm not sure where these studies came from, but 30 or 40 years ago, diuretics, the theory that it may be a little fluid in the inner ear and Diazide helps. And I've seen that, hundreds of times I've given them Diazide for 1 to 3 months and it made it go away. And then inner ear exercises, what we call vestibular compensation exercises, training of the inner ear. And you can look these up on the internet or a physical therapist can show them. Different maneuvers like the Epley maneuver, the Dix Hall pipe maneuvers where you lay on the back of the bed with your head down and tilt your head, flip up and flip it over. Thought that there's a little bit of fluid or a little otolith in the inner ear and you can jostle it out and make things better. I've seen that multiple times where I've done those maneuvers at the bedside and symptoms are immediately resolved. So that's dizziness. So very, very tough problem in neurology. Like, subscribe, comment, and more later.